Hello everyone. Today I would like to talk about rosacea. Rosacea is a rash on the face that is actually very common. We see it all the time in dermatology. It typically presents, it's a rash that typically presents with redness and flushing of the face, and it is frequently made worse by certain triggers. The main triggers are caffeinated beverages like tea, sodas, and coffee, spicy foods, red wine, extremes in temperature like the very hot or the very cold, and emotional stress, and sun exposure, and emotional stress. So typically to control rosacea, one of the recommendations is to minimize exposure to these triggers, or minimize consumption of foods like the spicy foods, the caffeinated beverages, the red wine that cause triggers in rosacea. Many times that's all that is necessary, and most frequently we need more than just that. There are many over-the-counter creams. Most of them are sulfur-based that help with rosacea. Most over-the-counter products are in the form of creams, gels, or washes that can be tried. But when that's not enough, it's not uncommon for patients to seek care. And when patients come into my office, I frequently focus on two things. I focus on the inflammation and the redness. And the inflammation, if the individual just has flushing and redness, I'm not as concerned about how much inflammation is there as opposed to when they have pimples and bumps, because those pimples tend to be very tender and many times they're itchy. That pretty much means to me that we have to be very aggressive with the inflammatory, anti-inflammatory treatment. And so frequently when individuals, depending on the severity of their rosacea, I might say, well, we may want to start out with just creams, or we may want to go straight to systemic agents, because the systemic agents tend to be more anti-inflammatories than the topical creams. And it all depends on the individual's extent of disease, severity of disease, as well as how long they've been battling it and their ability to tolerate the condition. If they're already frustrated and they would rather have it gone than try topical creams, well, then we move on to systemic medications like the antibiotics. And it's not uncommon for me to say, okay, we're going to do this defined course of antibiotics and we'll have you take them. And I know that they're going to work in combination with a prescription strength topical cream. I know that they will work, but when you come back, we're going to try to taper off to get you off the antibiotic and leave you just on the topical creams and see how that works for you. Because unfortunately, rosacea is one of these conditions that we frequently cannot cure for life. We frequently will see it again. It's a condition that we control. So what will happen is patients will get better and they'll clear. And my goal at that point in time is to help them maintain clearance. Many times, maintenance of clearance means continuing to use a topical medication to prevent a recurrence of the inflammatory lesions like the pimples and the bumps. Sometimes that's just not possible and the patient will flare again. And if that happens, well, then we have to do another course of antibiotics. And so rosacea flares, are once you know that you're dealing with rosacea and you know what medication regimen an individual responds to, they're relatively easy to control, because what will happen is the patient will flare, you treat it with oral antibiotics, back off to the extent that we can, Keep that individual on just topical agents, a wash, maybe a cream, and then if they happen to flare again, well, then we do another course of antibiotics, and like that. Ideally, I would like the time that the individual is not flaring to be longer than the time that they are. Unfortunately, there are those people that the minute we back off on the antibiotic, their rosacea begins to flare. And so we don't have the luxury of backing off. We have to continue them on an oral anti-inflammatory agent, because until you've had rosacea, you don't realize how much it will affect you on a daily basis. It's a condition that truly affects an individual's quality of life, because it affects your face. It's what people see on a daily basis. After I address the inflammation, then I turn around and I look at the degree of redness. And for some individuals, the inflammation is not the issue at all. It's the redness that's bothering them. And luckily nowadays, we now have creams that target the redness. But the same kind of products that treat the inflammation are not the same products that treat the redness. And so if redness seems to be a significant factor for the individual, then I talk about, okay, we have these creams that we could potentially use. Would you be interested in trying one? And, it's basically a daily application. And if the cream is not applied, well, then the redness recurs. Sometimes, even if the cream is applied, the individual is so red that all the cream will do is cause the redness to subside or to diminish. But inevitably, they will still be a little bit red, or maybe the redness goes completely away, but at the end of the day, you see the redness come back. It's how an individual responds to those anti-redness creams. It's very unique, and really you don't know what your skin is going to do until you try it. So I frequently encourage patients to try it if they're even remotely interested in controlling their redness. So in summary, the most common forms of rosacea result in flushing and redness of the face. Many times have pimples and inflammatory cysts and bumps. There are certainly other forms of rosacea that I didn't cover in this talk, but the most common forms are just like I described them. There are certain triggers, and it is highly recommended that we avoid those triggers to decrease the number of times that our rosacea flares. Those triggers include things like caffeinated beverages, alcoholic beverages, spicy foods, extremes in temperature, sun exposure, and very important, emotional stress. If that is not enough in controlling the rosacea, there's many over-the-counter creams and washes that can be tried, and frequently that, in combination with trigger avoidance, does the trick. And when that's not enough, then it's time to see a board-certified dermatologist. Some individuals, we start with creams and work our way up only if necessary. Other individuals will start with systemic agents and back off because we need to gain control and back off and get to creams that will then maintain control long term. The treatment of rosacea is very customized. It's very unique to every individual. And how an individual responds to treatment and how an individual is affected on a daily basis by the rosacea is it's very unique, and nobody can say one individual is not affected by rosacea. Very commonly, people feel like rosacea does impact their social interactions. So if you feel like your rosacea has just gotten to that point where it's bothering you, well, then it's time to pick up the phone, schedule an appointment with a board-certified dermatologist so you can be effectively treated. From the Alamo City, this is Dr. Ana Sauceda, helping you put your best face forward. Take care.